Good morning, good afternoon, good evening. I'm Kato Crescent, a 26-year-old male Ugandan, working with Tender Grassroots Organization located in Entebbe, Kampala, Uganda. I work there as a medical clinic officer and I'm an in-charge there. My roles and responsibilities at TGR as a medical clinic officer, I perform consultations in the OPD and IPD units. I also diagnose, help in diagnosis, treatment, management of patients in the line of Ministry of Health of Uganda and in the line of United Nations High Commission for Refugees guidelines. I also perform OPD ward rounds and assess patient conditions. I also determine discharge of OPD and IPD patients and assess their progress of illness. I also help in performing community mobilization and sensitization in curative and preventive medicine, and also reassure hygiene standards and promote hygiene precautions in the community. My goals for the community, or my goals as Kato Crescent, I would like to improve and promote health standards of my people in the community, especially in the Entebbe community, and also help and sensitize those people in preventing communicable and non-communicable diseases through sensitization seminars, health promotions, and sex education, all through medical camps, giving them medical camps and doing medical camps so that they can get that education, so that they can also reduce on the spread and acquiring of any diseases that can come out through any poor handling of waste or poor management or overpopulation or underfeeding or overfeeding. And one of my other goals is a reduction of HIV spread through promoting reproductive health in schools and in highly populated areas. I would also improve. I also want to improve and bringing medical services nearer to my people through carrying out services like immunization, not only in healthy settings, but also in the smallest area of the community, so that people can access that service of immunization and other services. I hope to acquire the reason why and what I would like to do to get from the Obama Foundation. I hope to acquire a scholarship from the Obama Foundation that would help me cater for my studies in medicine, in a bachelor's medicine and surgery, that would help me attain a physician qualification or a doctor qualification, and if God wishing, upgrade and do a doctorate in medicine or surgery, any surgery, to provide free and help me to provide free healthcare to my community and make that medical services easily accessible to my people at a cheaper cost or for free. Because since in Africa and if I've selected an area of my community, which is Uganda, we have health issues and the services provided to people are very limited. And so if at all I get that opportunity to be a physician, a qualified physician, at least I would promote health in my community by at least bringing services to the community by building at least a hospital or a medical setting, so that I can give my people access to free care, medical care, and free medicine, free antenatal, or circumcision services, or even HIV counseling and treatment, at least on a simple cost. I would also acquire a scholarship to be a physician, so that I can promote productive reproductive health and focus on HIV prevention. In my community, Uganda is more so affected by HIV AIDS, and less focus has been put on that. So if at all I'm given that opportunity to study for medicine and surgery, at least I would empower and emphasize leaders to focus on at least HIV prevention measures. And if at all there is access to give medication to the people who have already acquired the disease, I would also promote that. I would also encourage PMTCT, which is prevention of maternal child HIV transmission, through education, through antenatal, advising mothers to go for antenatal care, and also emphasize on sanitation. If I'm awarded a scholarship to study for bachelor's in medicine and surgery, and through all this, I would acquire skills from my studies to at least bring up my community and build up my community in terms of health, and become a leader that can at least emphasize our government to invest more in health, invest more in services that can be accessible by people, and encourage the government at least not to focus on transporting our people to outside communities or outside countries to seek medical care, yet we can also invest much money or invest money in our medical health facilities, so that we can at least get those services and provide them to our people, instead of transporting our people to outside country to seek medical care. Thank you so much. I'll be happy if at all I'm awarded this scholarship. Thank you.